My name is Natalie and I'm one of the midwives at Natural Beginnings Birth Center. And since it's Breast Cancer Awareness Month, we wanted to talk to you guys a little bit about different types of breast exams. The first type of breast exam is a self-breast exam, which you can do at home. Currently, it is not recommended that you do scheduled monthly breast exams, which was previously recommended, because they found that a lot of times whenever testing would be done, the bumps would be benign, and it just caused a lot more worry and there hasn't been a change in the survival rate between ladies who do self-breast exams versus those who didn't and just got regular clinical breast exams at their annual visits, which will be demonstrated later. So what is currently recommended is that women get to know what their normal is. Some ladies have denser breasts, others do not, and of course the volume of breast tissue can vary between ladies and between breasts. So the best thing to do is to use the same method as the self-breast exam to kind of figure out what you normally feel like and how things look in the mirror. So the first way to do this is to put your hands on your hips while you're looking at yourself in the mirror and stand up and just kind of look and see how everything is aligned, if there's anything pulling, puckering, if you have any redness, any swelling. All of those are signs that there could be something wrong that you would need to contact your midwife or provider about. The next piece would be taking your hands to your sides and raising them above your head to see how your breasts move when you move your arm. Again, if you see any pulling or puckering or any abnormalities, like an inverted nipple that wasn't inverted before, those would be all reasons to give us a call and let us know about it. The next piece would be just start to feel your own breast. Similar to a clinical breast exam, you want to start on the outside, on the very border of your breast, kind of like where the underwire would go if you wear underwire bras, and feel with your fingers, just like with little walking motions around the borders of your breast. And don't forget, up in this corner here, it's called the tail of Spence, there is breast tissue in your armpit. So make sure you feel up in that area as well, so then you don't miss any of your borders. And you can either do a spiral motion or an up and down motion when you check your breasts. Now, if you feel any lumps or bumps, make a note as to where they are, how big they are, and if they change in size, and whether or not they move. Those are all very important pieces that we would like you to tell us whenever you come to your visit, if it's something that you would like us to check out for you. Okay, so now for the clinical breast exam, it's a little bit different than when you're doing your self-breast exams or looking for your own normal when you're at home. During a clinical breast exam, we feel different layers of the breast, especially for ladies who are a little bit more gifted up top. We go through, we start at the edges and feel very lightly to look for any superficial lumps or bumps. And the best way to do this is to either go around kind of in a spiral type motion so you don't lose track of where you're going, or you can start at the top and go down and go back up in a zigzag type motion. So then as you continue around superficially, you would then again repeat that pattern with a little bit more pressure, so then you can get into the deeper tissues. And depending on the size of the breast and the amount of tissue that's present and the density, you might also need to do a third round so that you can get to the deep area of the tissue. Another part of the breast exam, with the arm raised, there's also a piece of breast tissue that goes up into the armpit called the tail of Spence, and so we would also be palpating that area as well. And lastly, I'm going to do it on this side so you can see a little bit better, we would also palpate the nipple area to look to see if there's any discharge. If you keep stimulating the nipple, there is a possibility that there would be discharge, especially if you're breastfeeding. So we only do it once, and if you stimulate a lot at home, then you might find that you would have discharge. So that is a clinical breast exam.